Hi everyone, I'm Jennifer. I'm a pharmacist here at MLK Health Center and Pharmacy with some tips for helping you take your medications safely and make sure that you get the full benefit of those medications when you take them. One thing that's really important when you're taking chronic medications or medications that you take on a regular basis for long periods of time is to make sure that you take it around the same time each day. So usually what I advise patients to do is associate taking that chronic medication with something that you do every day around the same time of the day. So for example, if you get up around the same time each day and brush your teeth, maybe associate taking that medication with brushing your teeth. So you take it right after you brush your teeth every day. And that way, one, you don't forget to take your medication each day, but also you're going to take it around the same time each day so that the level of the medication in your system remains around the same and you get the best benefit from that medication. So although timing of taking medications is very important for all medications, some medications specifically are more important than others. So medications that you take to prevent blood clots, for example, or your diabetes medications, those are even more important to try to take around the same time each day to get the best full benefit of those medications. One other question that we get a lot as pharmacists is if a medication is taken twice a day, when should I take it? Do I have to take it first thing in the morning when I get up and when I go to bed? And really it depends. Most medications, if they're meant to be taken twice a day, they're meant to be taken about 12 hours apart. It doesn't have to be exactly 12 hours. Most medications, that's hard to do in real life. But associate it with something you do kind of generally in the morning and generally in the evening. So whether it's easiest for you, if they need to be taken with food, you can take it with breakfast and dinner or with breakfast and at bedtime. But again, we want to try to separate those medications by several hours. So you don't want to take, if a medication is taken twice a day, you don't want to take it, in the morning and then a few hours later, and that's twice a day. Really, when we say twice a day, we generally mean about 12 hours apart. Same thing with medications that need to be taken 3 times a day. There's not as many medications that you have to take that often, but in general, they should be taken about 8 hours apart. However, in real life, again, that's really tricky to do, right? We don't want you to have to get up in the middle of the night to take your medications. So again, if you're having to take a medication 3 times a day, just try to split it about evenly over the course of your day to get an even amount of time between the times that you take those medications. Thanks for watching, and remember, we're always here to answer any questions or concerns you have. So please ask your pharmacist, ask your provider, and we're happy to help make sure that you can take your medications as safely as possible and get the full benefit of those medications.